Hi, I'm Queenie, and before we start, please subscribe to our channel so next time you'll be updated with our new releases. Hello everyone. Everybody wants to be in their best shape. You see people paying thousands of dollars every year at the gym or another health clubs to have perfect body. Some people get what they wish by just abiding by a good diet and precise exercise. But another miss many difficulties to just get rid of extra fat, not even having a muscular well-toned body. But have you ever thought about people who massively lost weight or women after pregnancy? What would their abdomen look like after such a significant change? Where does all the extra skin go? After losing a lot of weight, people are so proud of their achievement and overjoyed at their success. However, they still have loose heavy fold of skin left as a reminder of their old self. Also, we don't want to forget people who are trying so hard to lose abdominal fat in natural ways and they fail. All these situations make people consider plastic surgery. But can plastic surgery contour the abdomen, tighten the muscles, and flatten it? Luckily, plastic surgery can. It is called abdominoplasty. Our role today is to answer most of our questions regarding abdominoplasty. Today we have Dr. Rhee, who is a renowned cosmetic surgeon from Seoul, Korea. He is going to discuss with us about abdominoplasty from an experienced medical point of view. Hello, Dr. Rhee, how are you?
Good, how are you?
So can you introduce yourself to our audience?
Hello, I am Rhee. I am the head of plastic surgery at Grand.
So when do you prefer a woman to have abdominoplasty after giving birth?
Generally speaking, about a year later or a year and a half. Usually the stretched belly does return to normal to a degree. But after a year, it does not improve further. So it is recommended to do the procedure around that time.
How long does the recovery period be?
About a week. After 5 days, it is okay to walk gently. Many take a week off to do the surgery. Heavy lifting can be done after about 3 to 4 months.
So after the surgery, when can the client start to have physical activities?
When surgery is performed, for about a week or two, it is best to walk slightly tilted forward. After 4 weeks, one can walk fully erect. Light walking can be done after 4 weeks, even just 2 to 3 weeks after. Heavy physical activity should be refrained for about 3 months.
Would the scar be obvious after the surgery?
As for scars, 60 to 70% of patients have already had an incision, so the additional incision is only slightly more. So it does not stand out too much. In cases where the prior scar is highly visible, it can be done with lasers, removing the old scars. So the result is actually better than what the patient had before. Usually, the incision line is below the bikini line, so it is not an easily visible scar.
Abdominoplasty or tummy tuck is a cosmetic surgery procedure to remove excess tissue from the abdomen. The surgery is commonly used by women who have gone through childbirth recently. In terms of when to get the procedure, generally about a year later or a year and a half after childbirth is the best time to get abdominoplasty. Usually the stretched belly does return to normal to a degree, but after a year it does not improve further. So it is recommended to do a procedure around that time. Recovery takes about a week. After 5 days, it is okay to walk gently. Many take a week off to do the surgery. After surgery, for about a week or two, it is best to walk slightly tilting forward. After 4 weeks, one can walk fully erect. Light walking can be done after 4 weeks, even just 2 to 3 weeks after. Heavy physical activity should be refrained from about 3 months. As for scars, 60 to 70% of patients have already had an incision, so the additional incision is only slightly more, so it does not stand out too much. In cases where the prior scar is highly visible, it can be done with lasers removing the old scars, so the result is actually better than what the patient had before. Usually the incision is below the bikini line, so it is not an easily visible scar. Thank you for joining us once again at CloudHospital TV. If you have any questions or comments, please leave it down below. We'll respond to you as soon as we can.